Hi, my name is Debbie Payne, and I would like to say thank you for coming today to listen to my strategic plan for pain management for St. Elizabeth Florence PACU. Just a little background information. We started noticing decreased patient satisfaction scores after the second quarter in 2017, which continued to fall until the end of 2017. The satisfaction score for pain management goal is 68.2%. That is the 75th percentile in the nation. Our overall score for 2017 fell to 66.67%, which put us below the 75th percentile. This affected staff and management evaluations. This was 35% of their evaluation score under management goals. They received a did not meet. We also received 2 patient complaints, and the patients stated that they felt the nurses were condescending and were very unthoughtful about what the patients felt their pain levels were. The patients are taught to rate their pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain that you can have. Once the patient reaches a 5 and can state that their patient is tolerable in the PACU, we allow them to go back to their either inpatient room or the same-day surgery room. They felt that the nurses were rushing them and were very uncaring and just wanted them to state that they were a 5 and felt tolerable so they could leave. This is not what we want for our patient care. Both patients had different nurses and were there at different times. So we did a SWOT analysis to see how we could improve. First, we identified the strengths and weaknesses of the PACU. Then we identified opportunities and threats. We also created a strategic SMART goal, and we made sure that that aligned with the St. Elizabeth mission and vision. The strengths we identified were we have seasoned post-anesthesia care nurses. We have 8 nurses, and all of them have been there for more than 5 years. 2 have been there for more than 20. All but one of the PACU nurses have BSN or higher. We also have minimal staff turnover. The last staff member left a year ago, and that was due to moving out of the area. We have also just recently received magnet designation at the end of March. Some of the weaknesses that were identified: staff was minimizing patient view of pain. The staff was also basing patients' pain on nonverbal cues instead of the 0 to 10, and lack of standardization for charting the pain among the staff members. Opportunities and threats. Opportunities: we can team up with vendors that can help educate on pharmaceutical and non-pharmaceutical pain management. Non-pharmaceutical pain management includes relaxation techniques such as deep breathing exercises, music therapy, repositioning, or even just applying ice to the surgical incision site. Non-narcotics, but are still pharmaceutical, as long as they are not contraindicated by the patient, can be used. These include non-steroidal anti-inflammatories such as Toradol, oral Tylenol, incisional pain catheters that allow doctors to give local anesthetics directly into the suture area. Threats are the narcotics on back order or out of stock, and we've had that happen due to the hurricanes that hit Puerto Rico. The manufacturers are unable to get us the medications that we need, such as fentanyl, ketamine, Demerol, and morphine. They have also asked that we limit the use of our IV Tylenol due to the cost to the patient and the facility, which has caused anesthesia to look at different ways that we can give Tylenol safely to our patients. And decrease in reimbursement from insurance companies and from the Center for Medicare Medicaid Services. Our strategic SMART goal was to increase patient experience scores for pain management by 1.6%, to attain and maintain that score of 68.2%, which is the 75th percentile, over the next 6 months through the end of 2018. Of course, it does align with our mission and vision. St. Elizabeth's mission is, as a Catholic healthcare ministry, we provide comprehensive and compassionate care that improves the health of the people that we serve. And our vision, St. Elizabeth will lead Northern Kentucky to become one of the healthiest communities in America. Our stakeholder analysis are the ones that are going to help us to get where we need to be. The stakeholders that will be involved are the post-anesthesia care nurses, our anesthesiologists, our perioperative educators, our surgical patients and surgeons. The strategic map helps us to identify the areas and how we need to get to where we need to be. So in learning and growth, it's important that we educate our PACU nurses. Internally, it's very important that as managers, we recognize the nurses' execution and rewards. For the customers, it's important that we communicate those pain modalities and how we're taking care of them and what we're using. And financially, to make sure that we are maximizing the reimbursement by maintaining that patient score above the 75th percentile. Action plan. Staff nurses will be committed to the patient's pain management. Collaboration between staff and peri-op educators for update pain management education. And pain management competencies to be completed yearly by the staff. Our communication plan is going to be very important, and the first two that we will need to communicate with will be the anesthesiologist and the peri-op educators. They will be there to help us determine what education needs to be. We will do that through a team meeting and then follow-up emails to make sure we all understand what needs to be done. PACU nurses, we will talk to them in a team meeting and discuss the pain management. We will also include our huddle boards that we use daily. We will give research articles that will help them understand pain management, and we will use emails to communicate further meetings or updates. It will also be very important for us to evaluate and use metrics. We will use patient satisfaction scores monthly. We will use chart reviews on a monthly chart audit to make sure that the pain management is being charted and documented correctly. We will use computer-based learning reports. They will be checked weekly to make sure that the staff are doing the education, and we will check that to make sure that it's 100%. Financial reports will need to be monitored to determine to make sure that we are getting the reimbursements. And last, we will do feedback from staff through surveys or town hall meetings to see if there's any changes or if there's anything that they see that need to be updated. These are our references, and if you have any questions, please feel free to ask. And once again, thank you.